Hello, my name is Mackenzie Enmeier, and I am a second year at the OSU College of Osteopathic Medicine at the Cherokee Nation. The presentation that I will be presenting at OSU Research Week is Person-Centered Language in Major Depressive Disorder with Peripartum Onset, a cross-sectional study. And below are the contributing authors. The American College of Obstetrics and Gynecology recommends that clinicians screen women for anxiety and depression at least once during the perinatal period. However, underdiagnosis, inadequate referral mechanisms, and lack of treatment capacity can result in untreated major depressive disorder with peripartum onset, which I will be referring to as MDD-PPO. Removing systemic barriers to mental health screening and treatment may decrease the morbidity and mortality linked to MDD-PPO. A potential strategy for overcoming the systemic barriers that prevent screening and treatment for it is person-centered language, or PCL. The language used in medical research guides physician education and eventually impacting clinical patient care. Thus, improvements in PCL usage can reduce stigma and improve perinatal health equity. Our primary objective was to quantify adherence to PCL guidelines among journals publishing literature with regards to MDD-PPO since 2013, following the publication of the DSM-5 update with the qualifier with peripartum onset to major depressive disorder related to pregnancy. This cross-sectional analysis included a systematic search for PubMed for MDD-PPO related articles published from January 1st, 2014 to March 7th, 2021. Search returns were randomized and 500 articles were examined for pre-specified non-PCL terminology. Data extractions were conducted in a masked duplicate fashion. These investigators were unmasked upon completion to meet and resolve any discrepancies. Articles were assessed for deviance from guidelines or terms out of conformity with American Medical Association Manual of Style guidelines. Specific study characteristics for adherence to PCL were included by conducting a chi-square test, and the type 1 error rate was set to 0.05. As for the results, we found from screening 178 of those articles, of the 500 articles, so out of the 500 articles, we specifically selected 178 of them since they were specifically talking about MDD-PPO, and we found that 50.56 publications were PCL adherent. The most commonly used non-PCL words were depressed, suffer, psycho or psychotic, and blue. Other significant non-PCL terms included were afflicted, problem, and sad, and then other terms may have been disabled, mentally ill, manic, anguished, unstable, irritable, crazy, sick, and insane, but these were not found to be significant. As for our clinical implications, reports of patient experiencing judgment, disrespect, or verbal abuse while accessing patient care is common. For example, one study found that negative attitudes expressed by medical professionals were targeted not just toward the disease, but towards the person with the disease. Utilizing PCL as the first step in practicing person-centered care, which emphasizes individual preferences, needs, values, and along with the importance of informed decision-making, respect, privacy, confidentiality, and non-discrimination. PCL reduces systemic barriers by reducing a negative patient experience, which can lead to delays in treatment for avoidance of healthcare. This is critical for professionals encountering MDD-PPO, as previous studies demonstrated that derogatory behavior occurs most commonly in the OBGYN setting. Furthermore, adherence to timely treatment and follow-up for NDD-PPO is vital due to the potential severity of adverse events, including fetal morbidity. So for our conclusion, we found that nearly half of scientific literature on NDD-PPO was not adherent to PCL guidelines. PCL is viewed positively by patients, and it may lead to better patient-provider relationships and is recommended by the American Medical Association and the American Physicians Association. Thus, PCL should be adhered by authors who present NDD-PPO research, and implementation of PCL requirements within journals and accountability within the medical community will aid in continuing the shift towards reducing stigma and increasing advocacy for treatment of individuals with major depressive disorder, peripartum onset. Thank you for listening, and below is my contact and the other contributing authors of this paper, and thank you.